The MSF team leaves the tarmac road in the middle of the mountains and heads for Mlalweni and its few isolated houses without power or running water. Mlalweni is in the heart of the remote Shiselweni region in the southern part of Swaziland. These past few years, two pandemics, HIV/AIDS and tuberculosis, have taken a catastrophic toll on the Swazi people. Today, a child born in Swaziland has a life expectancy of 32 years. This is the world's lowest. In this country, every third person is HIV positive or has been infected. Every year, at least 5,000 people contract tuberculosis, the first cause of mortality linked to AIDS. More than 80% of those infected with tuberculosis are HIV positive, which is the world's highest rate of HIV-TB co-infection, according to the WHO. In Swaziland, this represents an unusual medical emergency, since HIV and TB are both diseases that develop slowly. Médecins Sans Frontières is supporting medical staff at 3 levels of the country's medical organization, in hospitals, health centers and community clinics. The absence of actual villages in Swaziland and the isolated way of life of the population led MSF to adopt a community-based approach using mobile teams. The objective is to get to patients before they reach an advanced stage of illness. Some 77% of the Swazi people do not know their HIV status. Thus, it is important to inform them of the need to be screened and to support them in tackling their illness. Because of that, the mobile teams include people living with HIV/AIDS who share their experience with others and help support patients follow their treatment. They also play an important role in tracing patients who abandon their treatment and who face the risk of developing drug resistance. MSF mobile teams offer quick voluntary screening during these awareness sessions. One of them meets a traditional doctor. However, this traditional doctor may not be able to identify all cases. When a person is HIV positive, his or her immune system may still be quite strong, and symptoms may appear at a later stage. Screening is therefore imperative.
I want to see if I've got HIV. I come from Makonda. There is no clinic that side. This is the only clinic.
Untraceable early symptoms, lack of information, long distances to reach a clinic that offers appropriate care, cost of transportation, uncomfortable treatment, crowded waiting rooms. For all these reasons, patients frequently arrive at the health center totally exhausted. In this part of the country, there are no means of transportation. Patients have to walk 2 hours or more in the middle of the mountains. The most seriously ill patients are transferred to the Langano Health Center. Patients who are less ill receive their HIV and TB care in the community health centers, closer to their homes. Since January 2008, more than 1,000 patients suffering from tuberculosis have been put under treatment in MSF-supported healthcare centers. 29 of them suffer from a drug-resistant variety of TB. Nearly 1,300 people living with AIDS have also begun their treatment.